what happens when you become a high quality, low cost physician group. So what are the possibilities? So I would like Raj Bansal to introduce Arthur Henson and tell us about what is possibility for people like us who want to learn from you, become try to become a high quality, low cost physician. What's in future?
I'm Raj Bansal. Um, it gives me an immense pleasure to introduce our CEO, Dr. Arthur Henson. He's a great friend. I tell him the worst thing he did was to become a physician because he is a material of the Microsoft CEO level or Intel CEO level, honestly do. He has great vision. He has great way to address all his employees, all physicians. And we are so blessed to have Arthur manage Palm Beach ACO, which has been number one for all these years, along with David Klabonis. Between two of them, they have made PBSCO a national name. It has been quoted in Wall Street Journal, American Medical Association, and several publications. So honestly, I want to thank both David Klabonis and Dr. Arthur Henson. He will be talking to us now. Arthur, you are on.
Thank you very much for that introduction. I do want to start off by saying this is an awesome event. Dr. Agarwal, Dr. Bansal, David Klabonis, Dr. Sanchetti, Dr. Dandia, this is just incredible. The enthusiasm you guys have and the energy you have to keep going late at night to do these meetings and get the troops riled up is something to be proud of. I'm going to talk today. I'm honored to be here to speak to this wonderful membership. I'm going to talk today about the possibilities. Palm Beach ACO has actually been in an incredible ride. We made mistakes early on. We built from those mistakes, and we're proud to help pave the road for other ACOs to be successful, like New Jersey ACO and like Doctors ACO. And we love to spread the gospel. We are learning and we are growing, and we want to continue and take more bites of the apple as we go on. We want to control our destiny. We want to live up to the roots of what we started to become a physician for, was to treat patients at the highest level with the least amount of interference from outside forces. The ACO concept has been incredible, that it allowed doctors to organize under a legal setting and allow us to get stronger together. The bigger we are, the stronger we are, and that's what we need to continue to do. David, can you go to the next slide? So I want to talk about moving forward. We want to explain what we have done down in Palm Beach County. We have taken advantage of our critical mass, our size, our track record, our strength, and we have jumped into the Medicare Advantage space. Why did we jump into the Medicare Advantage space? There's multiple reasons, but it goes back to our core belief to take control of our destiny, to not let us sit behind and let these big business insurance companies, hospitals push us around as they have been, and slowly erode our cost structure, our reimbursement structure, slowly erode our ability to treat patients freely, slowly to control and reduce our ability to provide quality care. It's a problem. You see 3 patients, all with the same diagnosis, 3 different insurances, and you have to treat them all 3 different because they have different formularies, et cetera, et cetera. And ultimately, at the end of the day, the person that is best to treat patients, the most ethical and the most cost-effective, is the physicians, and that's us. We are the ones with the power of the pen, yet we only control 8% of the pie, or get 8% of the pie, but we control 100% of the spend. That's unfair, and the ACO is the tipping point for us to get our processes back. So we've always talked about fee for service, and ACO is an awesome way to get value-based reimbursement for us and get us a little bit on the back end. But it's a future that is going parallel to Medicare Advantage, but the social economics is pushing more of the patients to Medicare Advantage. It's less expensive. They ultimately have they actually have higher quality rated, and it's something that the government simply wants. There are close to 900,000 providers, physician providers in the United States. There are close to 10,000, there are close to 10 million other ancillary providers in the United States under the Medicare program. And there are only 3,000 Medicare Advantage plans in the United States. The government would rather deal with 3,000 entities than deal with the exponential number of other physicians and ancillaries, and et cetera. So that is their goal. That is their push. They are pushing this narrative. And because the Medicare Advantage world has proven to provide a higher quality for the patient's experience at a lower cost, that is what they are pushing. You see from this graph in 2019, it says here that there are 22 million Medicare Advantage patients in the United States. And in 2021, that number is jumping to almost 27 million Medicare Advantage patients. Now, the total number of Medicare eligible patients is 67 million. So it's about 36% of the equation of all the eligible people are in Medicare Advantage. And you can see just 15 years ago, that was 5%. So let's fast forward another 10, 15 years, and it's exponentially growing. That number could be 60%. So our ACO patients are jumping into Medicare Advantage every year. It's something the government's pushing. It's something that's more cost effective to the patients. In fact, this year alone for patients, if they go into the Medicare Advantage space in 2021, President Trump in September reduced their fees approximately 11%. So it's 11% for them to be less payment for them to go into Medicare Advantage rather than stay for their Medicare fee for service that only covers 80%, and plus they need to get the supplement, et cetera. So Medicare Advantage, as you all know, there's no supplement that saves you 20%. Now their monthly payment has been reduced 11%. They may reduce that more, but there is a push to that. So it's our future for us to hopefully get into that space. Next picture, next slide. Boy, that's slow. So you see by this, Medicare Advantage is growing throughout the country. Florida is amongst the highest, 43% penetration. Georgia is 36%. And you see the Northeast is about the same. It's high as well. So it is growing in these populated areas. It is coming, it is growing, and it's something that the government is pushing. We need to embrace it. If we embrace it on our terms, that is our goal, to embrace it on our terms and create something that is quality, that is something that is controlling our future, and is something that's going to give us a hell of a return, not only in our the way we get reimbursed, but it's going to give us an amazing potential return of equity value. This is something that is very hard to get into. The barrier of entry of becoming an insurance company is not easy. We are breaking down that barrier and making a way to do this. my opinion, the ACO entity controlling a Medicare Advantage plan is controlling and owning a Medicare Advantage plan is a win-win-win. It's great for patients, it's great for physicians, it's great for our future, it's great for our control, and ultimately, we will do it better than any other insurance company in the country. We will do it ethically, the most ethical, and we will do it for the right reasons. So we always knew this. If we have the freedom to treat a patient the way we want to, we're not only going to do high quality, we are going to do appropriate cost, which ultimately is lower cost. Next slide. So the trick is critical mass. When we decided to do a Medicare Advantage and we plan and we were doing our exploration, we had our first meeting and we had a lot of physicians eagerly interested in this concept. So it does not work unless the membership wants to do it. We cannot come into New Jersey or Georgia and say, look, we are going to do a Medicare Advantage plan. It has to be the other way around. We will give you the seeds and you need to tell us we are ready. What does ready mean? Ready means that we have enough energized membership to take control of their destiny and their future and ultimately build an asset that is incredibly valuable. We'll talk about the value in a minute, but it could be incredibly valuable beyond your imagination. You guys now are creating wealth. You guys have always created wealth for other entities, significant. Yes, you're a physician, you're doing great, you're providing a great service, you're living well, you're built a nice practice, but what have you done with your pen and your power? You've made the hospital system worth billions of dollars in Wall Street. You've made the insurance companies worth ridiculously amounts of money. They go to Wall Street as well. You've also made nursing homes significant amount of money. You've made everybody a lot of money, a lot more than your typical physicians do in their practice. And that's because it's more than 10 times the value that every time you sign something, the dollar goes somewhere else, because we only get 8% of the pie, but we want to now step into the other portion of the pie. And that's what we're doing with the Medicare Advantage plan. We're protecting our ACO and we are protecting our future. Next slide, please. Another picture of our first meeting for our Medicare Advantage plan. Next slide. So the value is off the chart. Right now, Medicare Advantage plans are worth a lot of money. If you just build the network, in my opinion, will also be a tremendous amount of money. So some of the insurance companies have sold in South Florida. South Florida may be higher than others, but some of them have sold for a significant amount. There's one in South Florida. After 5 years, a businessman started it called Simply, and in 5 years, he sold it for close to $1 billion, $989 million, I believe. There's a company now called Devoted, which I am not sure the secret of why it's valued so high, but Devoted here in Florida has less than 4,000 lives, and it's valued at $2.4 billion. You can look it up as well. So a doctor's owned HMO, Medicare Advantage plan, will resonate like no other. It'll resonate like no other. It'll grow like no other, and it'll do the right thing for us and create potentially a tremendous amount of wealth. Yes, it is risky. It is risky, no doubt. And that's why, in order to disseminate the risk, we need critical mass. We need a grassroots growth opportunity for all our physicians in the Georgia, New Jersey area. If they want to do it, we need to do it together, but you guys have to show the initiative. And what is the initiative? We would like in the counties, if you can go to the next slide, David. We believe in Clark County, we would like to get 50 like-minded PCPs committed to this with a commitment of $25,000 each, and the same in Atlanta. So if we're able to get a grassroots push of primary care physicians in these counties that would commit for $25,000 each minimum, we believe we can start doing this network there. You have created, again, a tremendous amount of wealth. And I don't want to criticize MSOs, but MSOs in general do well. But at the end of the day, these MSOs themselves have created a tremendous amount of wealth that they don't share that equity value with us. They're just not in that business. This would not have an MSO. We are the MSO. We will do it better than anyone else. We have started in Palm Beach County. Our first date is 1/1/2021. We are super excited about it. And we are going to do it the best in the country, we believe. We're going to make a couple mistakes. So when we get to New Jersey and Georgia, we will have all those mistakes worked out so you guys can benefit from us because it resonates. Last thing I do want to say is this is something that you can legally own. You can legally own. You cannot own an imaging center and refer to it. You cannot own a home health agency and refer to it. You cannot own a nursing home and refer to it. But for whatever reason, maybe Stark didn't think any physicians would get organized enough to get into this business, but we are in this business now and we're in it to win it. And the ACO is an awesome platform. But if you don't do this, you're going to see in the next 10 years, 60% of your patients are going to belong to a Medicare Advantage plan. And if you participate in that Medicare Advantage plan, it's another lever for them to control you, to potentially take your patients and move them across the street if you don't behave. Another entity that can reduce and control your fees, however they decide to pay you. Our doctors here love this plan because the investors can never be kicked out of the plan. So they're comfortable in pushing their patients into this model. They're comfortable because they have a voice. Just like every one of you have a voice in the ACO, every one of you will have a voice in this Medicare Advantage plan. And the smartest people are not the guys on Wall Street with healthcare. The smartest people aren't the guys in administration of these large insurance companies or these large hospitals. The smartest people are the boots on the ground physicians that step up to the plate every day for the patient to do the right thing. But these barriers are so annoying when they tell us what to do and how to practice medicine. And these people, these accountants and paper pushers and MBA people believe that they know what's best for your patient. And they don't know. We know what's best for our patient, and it's time that we take control of our future and our destiny and our patients for the right reasons. Thank you very much.